The community calls him Uncle. He was born normal, but on his 10th birthday, he developed eye disease. The doctors convinced his mother that their son needed an operation to save his sight. The procedure was costly, and well-wishers had to fundraise. A few days after the operation, all seemed perfect. However, a week later, he lost sight. The hospital recommended another procedure to reverse the damage done, but the family couldn't afford another hospital bill, so he had to learn to live with a disability. The torment and anguish due to walls of iniquity and inequality in accessing healthcare are sinking Uncle and many other black families into poverty. More than 80% of households in his community cannot afford health bills, nor can they keep up with medical insurance premiums. A culture created by walls of negative politics, community exclusion in policy making, and ignorance. The one thing we cannot live without is the one that costs more than the family budget can support. The walls built by health inequity and inequality in Kenya are so strong and dangerously high that even the middle class must fundraise to pay bills. In contrast, the poor and vulnerable have to choose between food and medicine, so they will take cheap painkillers and other over-the-counter drugs that can sustain them. Uncle is one of the volunteers for Project Elixir, a new community health project daring to bring down the walls of iniquity and inequality in accessing holistic healthcare. Project Elixir is raising community consciousness toward holistic healthcare by increasing community understanding of health systems and empowering the community to support reforms in health service delivery as equal partners without coercion. The project empowers community members like Uncle to advocate for health reforms by recording and sharing community health experiences. We share these stories to inspire other members to advocate for reforms in health service delivery. Together, we can spark the revolution we need to bring down the walls hindering access to holistic healthcare.